Hi, Dr. E.
Hey, how you doing?
Good. How you doing?
Great.
Good. You guys, we're going to do a hip evaluation on Eric today. We're going to ask him some questions, so we'll start with our subjective. As we're doing this, you're going to follow along and write down questions that maybe you would have that I didn't ask, and we'll keep processing through the information as we go. So why don't you tell us a little bit about what's going on?
Okay. Kind of always had some chronic hip tightness.
Okay.
More particular, like in my kind of groin to the front of the hip.
Okay.
I can't trace back like to any specific point in time where I remember it happening. It's just always gets tight, and then it fluctuates to sometimes not being as tight depending on how active I am or stretching. I would say it just generally is like through this region and then down here a bit. And then I definitely kind of coincides with like my lower back. Like I feel it like in conjunction with my low back and the hip.
Okay.
So.
And you don't really know when it started?
No, not really. I mean, I would say I've had it for probably 10 years.
Okay. So as long as we've been married.
I mean, that could say something.
Right?
That could say something.
Do you remember any other injury that then it maybe led to your hip at all, or?
You know, the only thing I was thinking of that is my whole right side of my body has always been my issue. So like
Okay.
my ankle, I have this Haglund deformity, so it's like a heel bump.
Okay.
And I've had a lot of ankle sprains. So I kind of sometimes feel like, it could have manifested from like my ankle, then all the way up. My knee's been fine, like never ever really have any knee pain
You
at
better
all.
knock on everything.
Knock on
right
everything,
now,
yeah.
like-
But I feel like started in my ankle,
Okay.
and that, the ankle stuff I had in high school, but I don't recall any hip stuff at all in high school.
Okay.
Or even college, any hip stuff, but ankle stuff, high school, college. So it's probably just after college, PT school maybe.
Sitting a lot.
Yeah, it could be, yeah, and then started. But it's always this right side, whereas the left side, I don't have any of that. So.
Okay. So and it feels achy and stiff. Does it
Yeah.
in the morning feel that way?
Yeah, the morning, it's kind of, I'm trying to describe it. It feels like tight and pulling.
Okay. In the front.
In the front, groin, never sharp,
Okay.
never, I wouldn't even really necessarily call it even, my back is more achy. I wouldn't really even call that necessarily achy, just more of like a tight, stiff feeling.
Stiff feeling. Okay.
Yeah.
So in the morning, when you get up, or is it as you start to walk that it feels that tightness?
Just kind of as I start to walk.
Okay.
Yeah.
Do you ever get anything shooting down your leg?
No, I don't get anything numbness or tingling or shooting.
Okay.
Nothing.
No burning anywhere. Okay. Do you feel like you're getting better, getting worse, staying the same?
I think just staying the same. I don't think.
Okay.
I think maybe depending on what I do that day or through the week, it may vary, but it doesn't. Overall, I would say it hasn't gotten better or worse.
Are you better when you're moving?
Better when I'm moving.
Better when you're moving. Do you so kind of prolonged sitting
Yeah.
a little bit with that? Like if
Oh.
you were to drive from here to California, would that?
It would get tight. for
It would
sure.
get tight. Okay. More in the front, or that's when you start to feel your back too?
I don't know. They kind of just go together. I feel like.
Okay.
But, I would say my back is a little bit more tender, per se, whereas this is more tight. But I feel like both are just connected. Yeah.
Okay. Chronic ankle sprains on your right.
Yep.
And then, what have you done to help this? What makes this feel better?
Absolutely nothing. No. Occasional, infrequent, like have someone work on it. Usually only when it gets really bad, they'll have somebody work on it.
You mean soft tissue?
Soft
Dry
tissue,
needling?
soft tissue, cupping, dry needling, mostly stretching.
Stretching.
Yeah.
Okay.
And then all self stretch. I try to do that before I play basketball. I do a decent job stretching, and then a little bit like before I work out, but not.
Okay.
I would say I'm not on a consistent stretching program.
What would you say is a decent amount of stretching?
Like how much time?
Yeah, how
or-
much time?
I probably stretch it. I stretch it more before I play basketball because it's more like dynamic.
And how many times a week do you play basketball?
Once a week usually.
Okay.
Yeah.
And how long are you stretching for?
I feel like I'm getting interrogated here. So before that, I probably stretch 10 minutes before I play.
10 minutes. Okay. I think we have a couple people that can confirm or negate if you
Okay.
actually do that.
All right,
So,
great.
Okay. So after you stretch it on your own, does it feel better?
It does, yeah.
Okay.
After I'm warmed up, like if it's a workout or CrossFit or whatever I might be doing, like it's always stiff to begin with, and then once it's warmed up, it's better.
Okay. No bowel or bladder changes associated with any of this?
Nope.
Okay. Do you have anything else that you feel like can change the way that this feels? You said tissue work, cupping, all that stuff, stretching.
Yeah.
Anything else? Do you use heat? Do you use?
I don't really do anything.
Okay.
So,
Okay. And then how many times a week are you working out?
probably on average 3.
3. Okay. And what are you doing for your workouts?
Usually a combination of like functional weightlifting, like or CrossFit.
Okay.
So like
So
I'll do-
any pain with like deep squatting or anything
No,
like that?
it's never painful, but like if I were to do a squatting workout, like I'd stretch for a couple minutes, and then the first like set or two would be a little tight, and then it would be fine.
Okay. What are you hoping to get out of therapy?
I just want to not feel the tightness in my hip and back, so that I can just kind of get into working out quicker without having to have to feel it. Like
Okay.
just less frequency of like having your mind think about these things. Like if it was just once in a while, it'd be nice, and always kind of.
Do you feel it throughout the day at all?
Just depends on what I'm doing. If I'm just standing treating patients, I don't hardly notice it. I notice my ankle and heel on a daily basis.
Okay.
But as far as my hip and my back, I don't, unless like I'm showing someone a deep squat, but standing and working, I don't really notice it.
Okay. And then no pain at night.
No pain at night.
Great. Anything else that you think I should know?
No, I've never had any imaging done to it. I've never had, no like systemic weird things. I mean, I'm healthy otherwise, so.
Okay. Good.
Yeah.
All right.